Good morning, as it is in Ireland, or good afternoon if you were in to further Eastern Europe. My name is Kieran. I'm a physiotherapist based in Limerick in the west of Ireland, and I am a member of the European region of World Physiotherapy Professional Practice Group. For today's webinar, we're going to be looking at, some tips and advice on managing musculoskeletal disorders. And so my role will be to introduce some of our speakers, and along with my colleague Felice, I will coordinate some of the questions which you would like to ask the speakers. So we have a series of speakers, and if you have any questions for them, please send them in the chat, and we will ask those to the panel of speakers at the end. Our first speaker this morning is Németh. He is a private practitioner in Belgium. He is also the vice chairperson of World Physiotherapy Europe and chairs the professional practice working group on musculoskeletal disorders. Due to personal circumstances, Tim cannot actually present live this morning, and so he's provided a short pre-recorded video which we will play first, and then we'll proceed with the other live presentations. So I'll let you watch his brief presentation first.
Hello. In this first short presentation, I will provide an overview on a macro level. I will present facts and figures as a reference framework to set the scene. The other speakers will address much more specific details and present practical cases. Firstly, there is a legal basis for safety at work. Article 153 of the treaty provides the EU authority to adopt legislation. The Directive on Occupational Safety and Health Framework provides guidance on the issue together with some other directives listed in the slides, such as the Directive on Workplace Requirements, Work Equipment, and Display Screen Equipment. Furthermore, we have the European Strategic Framework on Health and Safety at Work, running currently from 2021 to 2027. This framework defines objectives, key actions, and presents instruments to aspire those objectives. Before the pandemic, some 5 to 6% of the people between 20 and 64 engaged in remote working. In 2020, this doubled to 12% on average. This is taking into consideration all professions. An article in Forbes reports similar numbers for the US, where before the pandemic, 4% was engaged in remote or telework. This number increased to about 15% in 2022. In the 2020 top 5 European regions that shifted to remote working, we can see that the percentages went up from a quarter of the working people engaging in remote working to 37%. If we look at the available data of low back pain, we see a rather high percentage of workers between 45 and 49 that are affected. There are some gender and age-specific differences. At any given moment, some 577 million people are suffering from low back pain. Furthermore, low back pain accounts for up to 50% of all MSDs, musculoskeletal disorders. Low back pain comes with costs. The direct costs are the contributions and the compensations paid. The indirect costs can be related to the decrease of productivity, disruptions of the team, and others. The risk factors for low back pain can be rather simplistically categorized in 3 branches. There are physical factors, organizational factors, and individual factors. You can see some examples such as the poorly designed home workstations or the inability to stop working when you are at home. It is difficult to present a full and complete analysis of the European data due to the vast differences of structures of the labor markets and the social security interventions. What we know from studies is that the financial impact of absenteeism due to musculoskeletal diseases and more specific low back pain is high. The financial impact is situated on multiple levels. Absenteeism due to low back pain is the cause of loss of production and work days. This has financial impact on both the employee, but also the employer. Sick leave and early retirement are a burden to society, as they have great impact on the stability of a healthcare and labor system. With this macro-level overview, I try to provide a picture of the importance of tackling the low back pain problem in the workforce population. As seen, workstation setup and posture relating to working are major factors contributing to the development, maintaining, or worsening of low back pain problems. In the previous decade, the design of the workstations on site are on average inspected on a regular basis. The speed of change towards remote working due to the pandemic did not leave too much room for similar structural adaptations to workstations at home as for now. Thank you.
Thank you. So we'll now move on to our next speaker. Now, our next speaker is a person who is well known to me. It's Pete Moore from the United Kingdom. Way back in the past, Pete was a person who had significant back pain, and it had a big impact on his life. And in the mid-90s, he attended a pain management program where it transformed his life around, and in his words, I think, made him a person again. And then for the last, I suppose, 25 years or so, he has used that experience to become a highly sought after educator, author, and coach. And he's going to talk to us now about the role of supportive self-management for people with persistent pain. We're all yours, Pete.
Oh, thanks, Kieran. Can you see the slides at all, Kieran?
Not just yet. Maybe just try that again.
Let me just try again. Hang on a second. There we go.
Lovely. That's coming through perfectly. Thanks, Pete.
Okay. Well, good morning, everyone, or good afternoon, or wherever you are. I'm in the UK, and thanks very much for watching this morning. As Kieran's introduced me, I used to be a patient with back pain, but now, after attending a program back in '96, I've become a person again. And but what I needed back in the days, then I needed a plan B. And before then, I was pretty stuck in the medical model of care, waiting for everything to be done to me or given to me, etc. But I needed a plan B. I'm going to come on to that in a moment on another slide. But this is one of my favourite quotes. A guy called Gordon Waddell, he's passed away unfortunately now, and but he used to be an orthopaedic surgeon. And I remember when I first started getting into coaching and stuff like that many years ago, 20 plus years ago. I attended a presentation in London, and he was there, and he said it's unrealistic to be totally pain-free before returning to work. Work is part of the rehab process, and you know that really stuck out for me, because I think, as I found that when I got back to work, it's actually it was part of the, as Gordon says, as part of the recovery process. A little bit about me. These memberships that I belong to, and educational stuff that I've been doing over the years. As I said, back in the early '90s, I used to be a patient with back pain, but I attended the input program in London, and what that program gave me was not only the skills and tools, but it gave me the confidence to manage my pain myself. But before then, I was like most other patients that people see, pretty led an unstructured life. While I was waiting for the healthcare professional to solve all my problems for me. But for the last 25 years now, I've been working as an educator and author, etc., writing booklets and stuff like that for people with pain, and also healthcare workers. And in recent years, I'm now working at Teesside University in the northeast of England, working on about pain management using VR and soon artificial intelligence, AI. So this is how I got stuck, and most people now, the pain cycle. That's in one of the little booklet I wrote years ago, which the NHS uses and other people. And for a lot of people, when I show this to people with pain, they go, "Oh my God, it's like looking in the mirror." They can see themselves in it, where they got their persistent pain or back pain. They get less active. Obviously, their muscles get weak and the joints stiffen. They used to start writing the no-go list. Well, I used to do this, but now I've had to stop doing that. Sleep problems, that's a very, very popular one. Stress, medication side effects, weight gain, weight loss, negative thinking, fear of the future, depression, which I think has become, when you've had pain for longer than 3 months, that starts to kick in. And obviously the one here about time off work, etc. And for me, I didn't, that's why I don't get angry about it anymore, but when I was stuck in that medical model, I actually lost 7 years of my life because I didn't work. I was getting very depressed, etc. So got on that program, gave me the tools and skills and the confidence to break out of the medical model. And I'm pleased to say, since 1997, I've not had to take any pain medication. The main message I give healthcare workers is about keeping us in the driving seat. If you think, for those of you watching or hearing the presentation, think about when you learn to drive a car. When you learn to drive a car, you're in the driving seat. You're not in the passenger seat. You're not in the back seat. You're in the driver's seat. Why? Because it's part of the learning process. But what happens is, going back to that medical model, it takes us out of the driving seat and it puts us in the passenger seat. And that's why we don't learn anything. So it's about, from the get-go, don't wait until 3 months down the line from when people start reporting back pain, etc. It's about keeping us in the driving seat. We have to do stuff, but don't go down this route of we'll try this treatment, this medication, etc. Be part from the get-go. Yeah, sure, prescribe your medication, but it's not. It's about, we need to start doing things like doing stretching, exercising, as they now call it, meaningful movement. Okay. So what do people want to learn? And I've over the last 25 years, I've always asked people that I know, what is it you like to learn? What keep you upright? What got you back to work, etc. And I've been collating them. I collated all this information I said over the last sort of 10 and 15 years. And these are the 5 things that people really wanted to learn. They wasn't that really interested in our the back works and all the science sort of stuff. They wanted to learn basic self-management skills. So goal setting, setting goals, and then set an action plan on how they're going to achieve those goals, how to pace their daily activities. Hey, problem solving, everybody gets problems in life, but when we got pain, back pain, we're looking for other people to solve our problems for us. So it's all about learning about problem solving, keeping active, moving, stretching, exercising, meaningful movement. That to me is my, I don't take any pain medication, as I say, but because I stretch and exercise every day, I've been doing it since 96. And that's why I've not taken any pain meds. It's because I'm doing stretch and exercise. And I was a bit of a gymophobic. I didn't really like going to gyms. But for the last 15 or so years, I've been going down to gyms. And when I started to go to the gym and do regular exercise down there, my pain levels dropped even more. So knowing what to do if something goes wrong. A lot of people with back pain, we're overachievers. We want to try and keep up with everybody else. So the chances of us having a setback is quite high. So when we do get a setback, it's knowing what to do. How can we get ourselves back in the driver's seat as soon as possible? This is, I've always seen pain and work being is an essential part of recovery. And that's why I included it in the pain toolkit booklet I showed you earlier on. So this is some of the text there. Okay, it's just some general text, but it was so important for me to getting people back to work, whether that's paid work or voluntary work, etc. It gets people back in their driving seats. And I've also included these handy tips in all of there's about 9 different toolkits, like a back pain toolkit, self-management toolkit, one for people with asthma, people with long COVID, etc. So that's about really, I'm going to sum it up where about what I do, etc. I know I've probably gone through it a bit too quick, so but I'm always there to answer any questions. If you're a bit shy answering any questions today, you can contact me via the website, or there's my email address. I'm big on social media. I like social media because I like learning from other people, etc. So I'm on Twitter, this is Facebook, and also on Instagram. So there you go, Kieran. That's about me at the moment.
That's great. Thank you very much for that, Pete. I know there'll be some questions for you on that, and there's a lot for us to think about in terms of how we manage musculoskeletal disorders in general, and indeed in this telework world, how we empower people to take on board some of those tips. So thank you very much. Our next speaker is going to be Sara Copsey. Sara has been employed as a project manager for the European Agency for Safety and Health at Work. She's been coordinating major projects on aging workforces and working in the broad area of chronic musculoskeletal disorders. And so she's going to talk to us now about teleworking and avoiding too much sitting. Thanks, Sara. We're all yours.
All right, thanks, Kieran. Oh, okay. Now what's happening? Okay. Right, can you all see that?
Yes, that's coming through perfectly.
Right, okay. Well, thanks ever so for the invitation to speak to you today about managing the risks of teleworking and avoiding too much sitting. So, home-based teleworking can have advantages. An EU-OSHA study found that since the pandemic, employers view teleworking more positively, especially the idea of hybrid working. And for workers, it can provide more autonomy and flexibility in the way they work. And for those with a chronic condition, it can allow them to continue to work. But it can also be detrimental to health if not managed properly. Among the challenges highlighted by the study were poor home ergonomics, the tendency to move less, and employers not carrying out the health and safety risk assessments that they're obliged to do. Also, work intensification, where workers feel they must be available all the time or have difficulty in setting work limits. Social isolation, which will depend on the nature of work and each individual's need for social interaction. And virtual team working requires an extra communication effort as you are missing nonverbal cues. And work-life conflicts can occur, we've seen women being most affected. So, as has already been mentioned, employers have a legal duty to carry out a health and safety risk assessment, and that includes for home working. Individual risk assessments for each worker are possible in the home setting, and self-assessment can be made using guides and checklists provided by the employer, backed up by the worker taking photos and sending them. The employer or prevention specialist may visit the home in more complicated situations with the worker's permission. And besides providing information, a risk assessment creates awareness of risks and their prevention among teleworkers and managers. So while improvisations to improve ergonomics are possible for short, unplanned teleworking, if workers are teleworking continuously, they need a proper ergonomic workstation. This includes an ergonomic chair, sufficient space for a desk, a footrest, a separate screen and keyboard and ergonomic mouse, and ideally a cordless headset. Just as in the office, attention needs to be paid to temperature, adequate lighting, avoiding sources of glare, and creating a good work atmosphere that's free from noise. Although background music can help you work, especially if you're alone at home. So going back to the issue of tendency to move less at home, our bodies are designed to move and to get the blood pumping and the oxygen flowing. However, workers can find themselves working longer hours without breaks when teleworking from home. Research tells us that you should always get up after 2 hours of sitting for at least 10 minutes. But short, frequent micro breaks are better than longer breaks taken occasionally. And we should all be aiming to get up every 20 to 30 minutes. Micro breaks can be achieved through standing up to take a call, or keeping your mobile phone out of reach, forcing you to get up, using the countdown timer on your watch or phone as a break reminder. Ideally, workers need to be able to alternate between sitting, standing, and moving about. But experts also tell us that there is no one best sitting posture to be maintained continuously at all times. Instead, we need to sit dynamically, changing posture frequently, because our next posture is the best posture. And we need employers to set up the work culture that promotes active working. But in fact, teleworking can provide additional opportunities for movement. Some tips to move more include wearing comfortable clothing so you can move and stretch easily, treating exercise with the same priority as a work phone call and setting time for it. Breaks to get out of your chair, move around and stretch could include doing a small household task, taking the rubbish out, or if you live in a flat, walking back up the stairs, or stretching while you're waiting for the kettle to boil or coffee maker to finish, or taking a quick run around the garden, or giving the dog a quick run. If you have a cordless microphone and you can turn your camera off during a conference call, you can walk around and stretch. A good idea is to schedule stretching breaks at the start and during online meetings. And workers should consider if there are different ways that they could work for short periods of time other than sitting at the desk continuously. A sit-stand desk is best, and IKEA now sell quite a reasonably priced version. But an ironing board or other standing work surface can be used for short periods of time. It has to be short periods of time. Or consider sitting on the sofa for online meetings, for example. So there's increasing evidence of a link between musculoskeletal disorders and stress. And we know there's a close link between pain and stress. Employers also have duties to assess and manage work-related stress, and stress and MSD should be addressed together. And this is particularly important for those with a chronic musculoskeletal disorder. So regarding telework, employers should get workers to complete a stress risk assessment and a short questionnaire. They should stay in regular contact with workers, encourage open talking, and encourage workers to share concerns. They need to hold regular team meetings and keep everyone up to date when people are working from home. And the first part of meetings, for example, can be used for workers to check in about how they're doing at home and how they're feeling. And it's possible to set up a virtual coffee room to maintain social interaction. Regarding work-life balance, employers should encourage good practices such as break taking, setting work boundaries, keeping regular office hours, and taking a lunch break away from the desk. They should support setting up a separate workspace and advice on setting times when you could be interrupted, or tips such as putting up a notice on the door when you can't be disturbed, and encouraging workers to get outside for a period each day for their mental and physical health. And employers should not email or expect answers out of office work hours. Workers have the right to disconnect. So the EU-OSHA study found that successful teleworking depends in part on the provision of support by the employer. Support should include providing ergonomic equipment, such as an external mouse, keyboard, screens, etc., or reimbursement for purchasing costs. They should be providing technical support and guidance on how to set up an effective home workstation, and actively promoting physical activity and regular exercise. They should also be providing training for both teleworkers and supervisors. This should cover all the issues: setting up an ergonomic work area, organising work at home, taking breaks, maintaining social contact, the use of software platforms, etc. And also they should be training supervisors and managers in their role in relation to teleworking, and motivating workers to report any problems and having a system for this. So in conclusion, employers need to address a range of factors to limit the risks from teleworking. These can include workstation ergonomics and the working environment, limiting sedentary work, stress and work organisation, and training for workers and supervisors. And all this should be put into a teleworking policy. And I'll finish by mentioning the ongoing European Healthy Workplaces campaign, Lighten the Load, on preventing musculoskeletal disorders. The campaign is currently focusing on teleworking and also covers prolonged sitting. And both of these topics, there are many resources and publications that can be downloaded from the EU-OSHA website. Thank you very much for your attention.
That's great. Thank you very much for that, Sarah. And indeed, I'd second that commendation to examine the Lighten the Load material, which is very, very useful. So our next speakers are from SAP, that is Jürgen Cremers and Mirjam Haitz. So Mirjam is an orthopedist and surgeon, and Jürgen is a physiotherapist and ergonomic consultant. And they're going to provide us with an overview of how ergonomics is practiced at their company and how they feel this can help prevent musculoskeletal disorders. So thanks, those slides are appearing. So I'll leave it over to you, Jürgen and Mirjam. Thank you.
Mm-hmm. Hello and welcome. First, we would like to thank you for inviting us to this webinar. Today, we're going to talk about our experience with ergonomics at SAP, and especially regarding working from home. We also present our SAP internal offerings to help prevent musculoskeletal disorders. To start with, we would like to introduce ourselves. My name is Mirjam Haitz. I'm an orthopedic and trauma surgeon, and I work as a company physician at SAP. I will start by giving you an overview of our SAP internal health offerings and introduce our department. After that, my colleague Jürgen Cremers will tell you about the special challenges of working from home regarding MSDs. First, a brief introduction of our company. SAP is the largest European software company. We have more than 440,000 customers in over 180 countries and 238 million cloud users. SAP employs about 102,000 people and has locations in more than 140 countries. As you can see from the quote from our CEO, the company really cares about the health of its employees. We are really happy to have the support of our CEO about the importance of health, safety, and well-being at SAP. Global Health, Safety and Wellbeing has about 49 employees. Among them, there are a lot of medical professionals such as physiotherapists, ergonomic consultants, physician assistants, psychologists, nurses, and doctors. And here you can see an overview of our health offerings in Germany. We have 2 medical outpatient clinics at our largest locations in Walldorf and St. Leon Roth, where we have a broad range of offerings, and many offerings are also virtual. For example, here you can see the event calendar of the Lighten the Load campaign within SAP, including online live events with ergonomic and physiotherapy topics. Okay, next slide. Due to global pandemic, we have had an exceptional situation in the last 2 years. Before 2020, very few of our employees worked from home, and this changed with the onset of the pandemic and the decision of the SAP board that all employees should work from home. Because of that, our team, and Jürgen in particular, as an ergonomic consultant, developed special pandemic-related support. Within saying this, I would like to hand over to Jürgen for more information about ergonomic offerings within SAP.
So hello and good morning or good afternoon, wherever you are. I took over to the second part. And also from my side, of course, hello and welcome to this really great webinar. My name is Jürgen and I'm responsible for the ergonomics department at SAP. I'm a physiotherapist and I have completed a 2-year further education training in Germany to become an ergophys consultant. And this training was really a great training. This gives me the opportunity to optimize ergonomic actions with physiotherapeutic strategies. And we all know the physiotherapists are the specialists about movement and human movement. And I would be happy to give you a brief overview of how we live ergonomics at SAP. So what do we look for at SAP? It's not only about giving ergonomic tips according to international ergonomic standards, then because we are speaking of working from home, not working in an office. Yes, so it's very important. It is rather about sensitizing people for pragmatic and creative solutions to their home in their home. So what is the benefit? Well, let's have a look at this. It's important that we have the knowledge of basic of ergonomic principles for all employees, not only at SAP, but for all companies. Then it's important to know how to create a healthy working environment at home so that you can stay healthy and safe. Okay, I think we all know that. Yes, we often like to work in positions which are comfortable, yet it might be potentially damaging. Yes, I know that. We all know that. Yes, these sitting positions are all very comfortable, and there is nothing against working in such positions. I love to sit on my couch and have the legs on the couch, just work with the notebook, but never for a longer time. Yes, it's so important. Sitting position should be changed regularly, and the next sitting position is always the best. And of course, we should work most of the time in an upright position, supported by a suitable office chair. So as we had seen in the slides of Sara before, yes, so this positions are just for a short time, but not for longer time. Now today we know, but all this only works if ergonomics is offered to the employees. And our experience and the feedback from our colleagues show that the work situation at home improves significantly when we have online workplace ergonomic consultations, and it must be an individual ergonomic consultation, which is adapted to the individual conditions at a workplace at home. And we have to offer pragmatic and creative solutions. We saw it in Sara's slide before. Why not working on an ironing board to work in a standing position? We know that it looks really fun, yes, and we are laughing about in a few months about it working on an ironing board. But if I don't have a sit-to-stand desk in my home office, yes, or in my workspace at home, it's a really good idea to do this or to take a bistro table on sideboard. So what we do at SAP with our online consultations, we are working, or I work with webcams or with a mobile cam on both sides, so I can see the workspace of our employees at home. And only then I can give individual tips and pragmatic or creative solutions. I have to see the workspace where they are working. Then, of course, it should be that employees are encouraged to purchase their own work equipment for home use, and of course, are given support on how to do so. They have to know what is the right equipment, which is the right size for a desk, which is the chair that fits to the person sitting on it. And of course, they must know where can employees buy this equipment. You can't go to a standard furniture shop and buy an office chair. you need a special office furniture shop to buy a really good office chair. And of course, when they have this equipment, we have to support them how to use equipment in the right or in the economical way. Yeah, a sit to stand is not useful when I don't use it or when I use it on the wrong height. So it's really important that we support how to use equipment. What go on? Hello. So, and especially in the last months during the COVID-19 pandemic, it was possible that our colleagues can take work equipment at home for time being. So because the pandemic 2 years ago, that comes so very fast, all of our employees, they don't have an office at home. And so they could take a work equipment at home for the time being, as long as the COVID-19 pandemic is on. So what we are doing at SAP to support our employees, we have a lot of further offers. You see here on the right side a few examples. You see we have videos how to set up an ergonomic workspace. And of course, I told before, we have personal and remote ergonomic consultations at our desk in the office, but also in the desk, or better in the workspace at home where we work. I told it before, with webcams that I can see the workspace in the home office. I don't want to say office because most of us don't have an office at home. Then we have ergonomic tips for working from home on our SAP internal platforms. But that's not enough. We have to do this before MSD is coming on or is going on. But sometimes it's too late and the colleagues have MSD problems. Then we offer physiotherapeutic services since the pandemic. Since the pandemic, we have online physiotherapy. We offer massage in our headquarters, and we have the physiotherapy to go. That means we have more than 60 short physiotherapy videos, 1 or 2 minutes. So when one of our colleagues said, "Oh, I have back pain, I need some exercises for that," they can go to the physiotherapy to go site, give in a lower back pain, and then he will find, or they will find some video series to the lower back pain or shoulder pain or whatever they want to look for. And of course, we support our employees with further offices. You see a few examples here. For example, our virtual health days. We have this virtual health days in all offices worldwide in the spring and in the autumn of every year. And you can see a small selection here on the left side, what is offered. Then we have collaborations with health insurance companies that also offer own health promotion events. And of course, we are part of the Light the Load campaign worldwide with a lot of activities for our employers. So that was a short, brief overview of how we live ergonomics at SAP, and I thank you for your attention.
Thank you very much to both Mirjam and Jürgen for that presentation. And now we move on to our final speaker, who is Dr. Yvonne van Zaanen, who is a physiotherapist in occupational health and ergonomics in the Netherlands. She's currently completing her PhD in this area. She is currently president of the Dutch Physiotherapy Federation and vice president of the International Interest Group among Physiotherapists for Occupational Health and Ergonomics. We're all yours, Yvonne, if you want to share your slides.
Okay, thank you. Thank you for inviting us over for a talk today. We were asked to have a short talk about what physiotherapists can add in preventing and managing musculoskeletal complaints. So that's why I am here, because I'm the vice president of the IFPTOHE, the Association for Physical Therapists in Occupational Health and Ergonomics. And the title of my presentation is that there is more than ergonomics. Ergonomics is very important, but you already saw it by the earlier speakers, there's more to do in prevention and managing. Well, Sara luckily has talked already about facts and figures, so I won't go into that. I will only take you with me along the way for physical therapists, what they can contribute. Sorry, I have to change one thing in my screen. So I'm going to talk about 3 things, and that's about prevention and managing at the workplace of these musculoskeletal diseases, and why it is more than ergonomics and how the physical therapist fits into that, the responsibilities of both employer and employee, and why early signs are important to recognize. Well, when I'm saying this, I think, oh, we already heard a lot about this. So, well, I hope I can add something to what you have all heard before. First, I have a figure. This is from the Netherlands. It's originally in Dutch, created by TNO. I translated it myself, so mistakes are on my behalf. Sorry for TNO when it is. But why I wanted to show you this is because it's an important strategy. It starts at the left with top. That's like, well, great, you're doing great. And that's the strategy you choose when you want to eliminate or reduce risks at the workplace. So you start with the technical measures, then organizational, and at the last part, the personal. And it can also be technical or instructions. And in the technical part and organizational measures, they need to be in place to make the work healthy. But sometimes it's not possible, or it is just not sufficient to limit the risks. And you have to do more. You have to give a personal protection for the risk or a personal instruction. And here is where you see a lot of physiotherapists in place, working with an employee in how to reduce the risk, or how to move, how to have a healthy behavior at work. And along this whole path, you see also that education and training is important. It is smaller because when the technical and organizational measures aren't in place, well, you can train a lot, educate a lot, but it's far more difficult to do your work healthy. So that's why it's smaller, but it is still important. And that's also about when you provide employees with lifting hosts, for example, in hospitals, that they don't use it, or it is too far away to get them. So training and education is also important. And physical therapists, they have the knowledge about movement, but also about recovery from injuries. So that's why I think they are at much companies taking this preferring this education. So my next slide is about the complex system of a worker with a disability or with musculoskeletal pain. And I wanted to show this because you see all the factors that play a role in the workplace system, the top end, the personal system, but also the healthcare system. And physiotherapists already are familiar with the personal system, the personal coping. We already heard Pete tell about the self-management, that kind of approaches. are familiar, and they also know the healthcare system. So the new part mainly is the workplace system and the legislation. And what Jürgen was saying, many physiotherapists also has an extra education on ergonomic measures, the guidelines, risk assessments. So when they are a physical therapist in occupational health and ergonomics, they know more about this also. But when you want to work with an employee with complaints, you also have to work together. And that's the main message I want to give with this slide, is you have to work together with the employee, with the employer, with the ergonomist, with other healthcare professionals, the supervisor, and that's a really complicated, or it can be complicated, but also very challenging and nice to work with. And what Jürgen was saying about being creative in finding solutions, I think that's the most important part. And that's also why the participatory ergonomics approach is effective, I think, is because you really get into the problem together with the workers and the supervisors. And I want to give one example for a worker, for a tailor worker. She was having neck and arm complaints, and the issue wasn't her ergonomics. That was fine, or I have to be clear, the desk and her chair, that was fine, but she felt a little tense, also from other causes, and she also translated that stress and tension into a muscle tension, and that's why she came to us, and we trained her how to deal with the tension and also not translating it into muscle tension. We do that with biofeedback or myofeedback. And also she was using the mouse a lot, so she had a long time for, sorry, I lost the word. And for her, the shortcuts on the keyboard were far better for her arm. So that were the solutions for her, managing the stress, keyboard use, more keyboard use than mouse, and letting her tension go from her muscles. So why are early signs important to recognize? Because what we see is that people come to a physiotherapist when there are already problems, and you really want to know when there are signs in an early phase, so you can act earlier. And I want to ask you, why would you do it when you look at your car? Why do you do maintenance on your car? So can you please type in the chat, why would you do that? Give service to your car. And I have to ask Aita to tell me what is in the chat, because oh, maybe here I can see it. Yeah, to avoid future issues. Oh, you don't service your car? Less expensive, avoids breakdown. Yes, okay, thank you. Well, and that's why I would compare it. Oh, now it's not working. Yes, I think the same is with a healthy workforce and keeping the workforce healthy, or also at an individual level. You can prevent for bigger issues. So here's the list for the car. You skip that. Go to the physical part. It increases physical health, keeps employee performing at its best, saves you money, no productivity loss or even sick leave, lowers the cost of support, and saves you time, preventing for large issues. And keeps the company value high, staff retention. That's also a main part in costs of a company. When the work is less healthy, causing more problems, you see that staff will go away earlier. So this is why I think why I would like this comparison. Well, my main three messages: prevention and management of musculoskeletal disorders at the workplace is more than ergonomics. We also have to think about healthy working behavior. And there are different ways of doing that, of training and educating employees. And you have to do it together, but it's very important, the behavior. Responsibilities for both employer and the employee. The employer must provide the employee with a healthy workplace, but the employee must also act like he should with the stuff he is using. But the most important on that part is work together. And when it's difficult to do it together, get help from a professional. But I think when you really listen to each other, work together is already fine with an employer and an employee. And why early signs are important to recognize, well, especially for physical complaints, when you act at an early stage, you can really prevent for worse. Changing small things can really make a big difference. So that's for my presentation. Thank you.
That's great. Thank you very much, Yvonne. And thank you to all our speakers. So I guess this is the time for us to address any questions you as participants have. So if you have any questions, if you want to send those in the chat, and again, Felice and I will coordinate those and ask them to the panel. And just while we're waiting for some more questions to come through, I guess I have one overall comment that I'd ask to or question I'd like to put to all of the panel for any of you to speak on. And I guess it strikes me, and this is a good thing, I would argue, that there's a range of speakers from different backgrounds, from a regulatory framework, physios, medicine, ergonomics. Pete is a person who used to have pain, is now an educator and a coach. And it's really good that you've basically agreed on most of the things that people and employers should do. And so that's really good, but it does beg the question, well, if there's pretty good agreement, why do so many people still have MSDs either in their workplace, in their office, or in today's context or in terms of telework? And I guess part of that, I suppose an additional concern is that if we go back to when I qualified as a physiotherapist 23 years ago, and when Pete was a patient in the mid-90s, not everything, but a good few of those messages would even have been known maybe 20 years ago. So I guess my question is, if there's broad agreement, what's holding us back from implementing these, the messages that you've proposed there, which I totally second and seem very sensible? What's the next step forward? Feel free, anybody who wants to jump in on that. Sorry, Pete. Yes.
I think it goes back to what I was saying about the medical model, really. It's that very first, when a person sees a doctor, a GP, or a healthcare worker for the first time. Because what I've learned over the years is that very few healthcare workers learn about self-management while they're in medical school. And from what I understand, talking to healthcare workers over the years, it's something they're expected to learn while once they leave medical school. But I think so when a person with back pain presents themselves to a GP or a healthcare worker, the chances are they're not going to see someone who's has experience in, you know, teamwork, coaching, etc. Like, you know, because I was thinking like a healthcare professional these days needs to be more like a coach rather than you know, especially with long-term back pain. They need to think more strategically. So that's what I'm saying about like the coaching skills, like setting goals, action plans, keeping people in the driving seat. But I think too often, you know, it's we'll take this medication. If it hasn't got any better, come back and see me. So straight away, see the doctor or the prescriber is saying to the patient, "Hey, listen, don't worry. If this doesn't work, I've got something else here that you can do." So you're giving straight away. So you're taking people out of the driving seat, putting them in a passenger seat. They don't think, well, all I've got to do is just take these pills. Where really the healthcare worker or the coach needs to say, well, okay, this is what I'm going to be doing. But more importantly, what are you going to be doing? You know, so it's about finding out from the patient what sort of things that they like doing movement wise. It doesn't necessarily have to be, you know, going down the gym, etc. It may be yoga or Tai Chi or something, or Pilates, dancing, working in the garden, etc. You know, finding out what they enjoy doing and getting them to say, well, let's work out a plan how you can get back to that, because, you know, people have now reported for years now that meaningful movement, stretching, exercising really helps their back pain, really, you know. So I think it's about having those conversations from the get-go. What tends to happen in the medical, something going on a bit, Kieran, so apologies. What happens is that healthcare workers, it's like a fireman, like saying like a fireman goes to a house, okay, and they see smoke coming from the house. And the fireman stands outside, five persons, firefighters, they're standing outside. Well, we ain't going to do anything about it until the house bursts into flames. We can see the smoke, but we're not going to do anything until it bursts into flames, and then we'll go in and sort it out. And that's really that's how healthcare is at the moment. Is they wait until people are in big trouble, and then they think about, okay, well, we've exhausted all the pills, the treatments, the whatever, and then, well, I think you need to start learning about self-management. And even the term self-management for a lot of people can get mixed up because they're thinking they're cutting me adrift. I've got to go and do it myself, you know. We tend to use the term these days, supported self-management, but it's about what Yvonne was talking about with, you know, in her presentation. It's about teamwork, you know, about the person with back pain work closely with their healthcare team, who is actually in the healthcare team. It could be a physio, an OT, a family member. You know, it's about working as a team together, so to keep them in the driving seat, get them back to work, so they can get on with their life.
That's great. Thanks a million, Peter. And obviously, you know, from my background, that I'd be biased to agreeing with all that. And so we have a sense there around the cultural training of a lot of healthcare professionals, the insistence that as the expert, we will tell the person what to do and so on, rather than empowering, you know, the person with pain. Anybody else want to add on to that? Yes, Yvonne?
Yes, thank you.
I see her then?
Yeah. Well, I think there are still a lot of workplaces that aren't healthy. So there is a lot more work to do to make more workplaces following guidelines. So that's why complaints are arising. And also about the healthcare system, I also think, or for the Netherlands, let us speak for the Netherlands, there is now, there are special projects to give attention to work. For most healthcare workers aren't giving attention to work. So I think as a physiotherapist, we are used to dive into what are you doing, sports, your free time, your at work. You want to know that because you are thinking about the musculoskeletal complaints, but also other kind of healthcare professionals. There is really a need for attention to address work. So what is the medication doing for your work? What is the treatment? How does it interact? Can you still work with these complaints? I didn't talk about that, but I think that is very important. I think it was Pete also. But you don't have, sometimes, for instance, the example I gave from that worker, for her, it wasn't helpful to get sick leave, because she wouldn't learn how to deal with her tension, with the keys, not transferring the tension to her muscles. So for her, she had to practice at work. So
thanks, Yvonne. And I guess that even that point you raised there around her understanding why that might be appropriate is a bit like Pete's comment on the self-management not being seen as being abandoned. So it's important that when we are talking about empowering a person with pain, that it's not that we're refusing to give them what they think they might need. Sarah, am I right in saying I saw your hand up as well there?
Yeah, if there's, to see if I can find a couple of things to add in addition to what's already been said, which I agree with. One of the things we're doing in the campaign is trying to get the message across, especially to smaller businesses who don't have the kind of resources of SAP, that many measures to reduce musculoskeletal disorders are low cost and easy to implement, because especially smaller businesses think it's complicated, think it's difficult, and think it's going to be expensive. So I mean, an ergonomic mouse or something like that. So to change the idea of not thinking of health and safety as a cost, but seeing it as an investment that can be savings in the long run. Something else that we've mentioned today, and it's not just about health and safety. I mean, it goes through all ways of working at work, and that's about having the open conversations, so that problems get reported early for prevention, or and if workers have a condition which might not be work related, that they have the confidence to report that, knowing that they'll be listened and taken seriously. And the whole as has been said, worker involvement. But you need to have that kind of culture. It's not just related to health and safety. If you don't have that culture of trusting employees and open conversations, and then also changing the culture about moving at work, and not this idea that productivity means having the person working continuously, because that's bad for musculoskeletal health, it's bad for stress, and it's bad for productivity as well. So changing, and things are some jobs getting worse at the moment with this idea of algorithmic monitoring, constant monitoring in some types of jobs. So in some aspects we seem to be going backwards again in what should be considered quality work and humanized work. So I think I'll and just to reinforce this whole thing of the medical profession seeing work as a treatment outcome. And it's great that physios are having ergonomics work and ergonomics as part of their training, but having occupational safety and health as part of general medical training is, if they get it at all, it's a really short time, I think, that they're spending on it still. So we need that work as a treatment outcome, and knowledge throughout the medical profession as well. I'll leave it there.
Lovely, thank you, Sarah. And it's interesting, and a few of you have touched on that point of culture, relationships, communication. And again, we've probably all become familiar with examples of where people have found the shift to telework has helped because they avoid certain situations or personality where there is conflict, or equally, as you mentioned, Sarah, the degree of social isolation and lack of connectivity with colleagues, especially if you're a new worker to an organization, can further exacerbate issues around awareness of the culture and knowing your staff. I'm just conscious of time. Yvonne, this question that we've got in the chat might be for you. Do you have information on how many physios are represented in the field of occupational health in EU countries? Now, I guess that might be very broad because it might be, within different countries, it might differ, but a sense of how many physios are working in that area across the EU?
Yes, I can't say. What I can say is that we have 14 European countries in our association. But that can also be physical therapists that are interested in the field. But I don't know how many physiotherapists are already working in occupational health and ergonomics.
Okay, thanks, Yvonne.
I think there is no number. We can't tell a number, but I would say it's too less, of course, because we are speaking about occupational health in companies, but which companies have an occupational health? As a global player or big companies like SAP or like Siemens or whatever. I know in Germany, all big companies, they have ergonomic departments, but what's about with all the smaller companies with 10 or 100 or 200 employees, there is a gap. We have a big gap in companies with this number of employees. And so for me, one of the most important questions is how can we reach these companies? How can we reach these employees in the smaller companies? And so I don't have a solution for it. Maybe you have tips or solutions, or maybe this is a support what the world physiotherapists can help for all the small companies, that they can have an economic support from specialists like we are.
Lovely, thank you.
And maybe sorry.
No, go ahead, Yvonne. Yes.
Maybe that smaller companies also don't know that we are also working as a freelancer. So the big companies, then you are an employee.
No, I'm a freelancer.
Oh, sorry. Sorry, my fault.
Yeah, but that doesn't.
Yeah.
Yes.
But I think that's also a misunderstanding.
Yes.
Can be a misunderstanding.
Yes.
Lovely. And then I'm conscious of time, and I just see Pete here. You've asked a very interesting question, and I'll give you my response to it. The question was, how many healthcare professionals here today learn self-management in their various medical schools? Now, in my background as a physio, obviously, I would say, reflecting my age and my balding hairline, over 20 years ago, I would have learned a little bit about self-management, but to be honest, it would have probably been tokenistic. And I would say it was definitely not the supportive self-management that you speak about. And I think there are, as you said, about the problems of the medical model, there is now maybe a better awareness of the limitations of the medical model. But now a lot of the stuff around self-management, I have a concern that now all we're doing is, yes, limiting access to unhelpful MRI scans and surgeries and mitigation. So that's good. But then that's where it ends. So we're just avoiding harm, but not giving a better alternative, either in terms of rehabilitation or workplace supports. And I would have some concerns that then we almost leave it up to the resources of the person. And as some of our speakers have touched on, if you are fortunate enough to maybe be with a good employer, socioeconomically be able to afford some additional supports, you will be able to get that coaching and that support. Whereas I feel, if we look at, for example, some of the stuff Pete has touched on there, some of that rehab, coaching, educating is not as well funded as if you came up with a snazzy drug stem cell surgery device in the morning. And that's a societal challenge. Yeah. Felice, would you like to, because I've covered, I think, most of the questions that have come up in there. Felice, do you have any comments or questions before we close? Sorry, Felice, you're muted, I think.
Sorry. I have one question, and I have also some information about the engagement with the physios and then the small or the companies in terms of prevention, in terms of teleworking. As Turkish Physiotherapy Association, we made an agreement to consult one of the bedding company this year. And the other part of the agreement to give physiotherapy services of the customers to prevent MSD. The physios are working in the sales office of the bedding company and provide some information to the customers about MSD and the prevention. That's why we may do this kind of small agreement as physio associations or maybe some universities, whatever. And then I'm going to ask a question to Sara. As we know that even if there is no longer on acute sources of pain in chronic stage, but the individuals still have pain in this period due to brain plasticity, and this will work as vicious cycle, resulted with kinesiophobia. As physical therapists, we should break down of this vicious cycle of the patients and have to use biopsychosocial model. In this context, what you recommend us as physio? What would you recommend us as a tip to support our patient in terms of psychological part? I mean, we do recommend to our patients to do exercises, but sometimes they are not so keen of practicing exercises, and then because of kinesiophobia and this vicious cycle, what do you recommend us as a tip?
Oh, that's a big question, and this is, I mean, I ideally for supporting people to remain in work and getting people back to work, you need a multidisciplinary team where you've got support from
psychologists,
different parts of the medical profession, physiotherapists, psychologists who are or others. I mean, it doesn't have to be psychologists. It can be people like Pete, but who know how to coach in that kind of if you like, the psychological parts of managing your condition or managing your pain. So it's a big ask to ask physiotherapists, I would have thought, to do everything. I mean, of course, if there are courses to give physiotherapists some insight into that, so they can give some basic support to their patients and clients, or point them. A lot of it's pointing people in the direction of where to go. But the best member states of getting people back to work actually have a multidisciplinary kind of employment back to work system, where you've got one person or a coordinator of the person's route back into the workplace, which can be coaching for work or psychological, physiotherapy, medical, and providing support to the employer as well. So that's the ideal situation, and probably one specialist can't do it all, but there needs to be coordination between the different specialists, some way of coordinating, so you're getting a proper package which is tailored to the individual.
Lovely. That's great.
I agree.
Listen, I'm conscious of time and you know, the time we've taken up of our speakers. So on behalf of Felice and myself and the European region of World Physio, I'd like to particularly thank all our speakers for first of all, I would say a very consistent evidence-based message from different perspectives, and those different perspectives offer us, I suppose, opportunities for looking after people in work in terms of the telework, but obviously some of these principles will also apply to the more traditional workplace settings. So thanks again to all our speakers. We really appreciate it, and thanks to all our delegates who participated today. Thanks again, everybody, and have a good day.